Hi you guys. Okay, full disclosure, today I had a Diet Coke and a coffee, so I'm gonna be kind of hyped today. Okay, so today we're gonna be talking about what happens in that initial therapy appointment. Going to therapy for the first time can be overwhelming and anxiety-provoking on its own, but not knowing what happens in that first appointment just makes it even worse. I have been in this field for over 10 years, and as a therapist, I've done hundreds of intake appointments. So today we're going to be talking about exactly what happens in that first appointment. Before we get started, hi, if you're new here, I'm Jessica. I'm a licensed counselor in Colorado, and I created this channel just to make therapy and mental health topics feel approachable and kind of take away some of that stigma and fear that comes along with it, and also to create a community where we can talk all things mental health and therapy. So before you go, like this video or subscribe or leave a comment, whatever you feel comfortable doing. But I would love to have you stick around and join the community, and I would love to chat with you in the comments. Okay, so here we go. These 7 things are usually present in every intake appointment. So the intake is what we call the first therapy session. And these are usually present if there's enough time. So at my practice, we just do a 50-minute intake. Some practices do longer ones, but even in 50 minutes, I can usually fit all of these things in. So so the first one is that you are just going to introduce yourself to your therapist. They'll introduce themselves, and then they will talk about confidentiality. So confidentiality is basically the things that the therapist is allowed to disclose, because as you know, therapy is supposed to be completely confidential, but there are some instances where the therapist can break that confidentiality. So you should have signed paperwork that explains all of this in writing, but your therapist will probably also go through it briefly in person just so they know that you know and you guys are all on the same page. So if you're wondering the instances where they can break confidentiality, because that could be kind of scary to know, like, oh, my therapist can tell people my business, but really the only cases where that can happen is if you've talked about child abuse, where children are kind of still in danger, elderly abuse, so abuse of an older person, or if you are at imminent risk of hurting yourself or other people. So if you say, like, I'm gonna leave this session and I'm gonna go hurt this person, they have a duty to warn. Or if you say, like, I'm feeling unsafe and I could hurt myself, they are gonna take action steps to keep you safe. If there's like a bunch to confidentiality, but I don't know if it's boring. So if you guys want a video on it, let me know and I can do that. Otherwise, yeah, those are the basics. The second thing that's going to happen in this intake session, and probably one of the most important things, is that you're called the client, are going to talk about what's bringing you to counseling now. So there might be a culmination of things that's making you want to go to therapy, or something that's kind of happened recently in your life. But yeah, this is when you're going to talk about what therapists call either the presenting problem, or they'll call it the primary concern, something like that. So they're just gonna ask you what's bringing you in, and you're gonna kind of share, and that question can be really open-ended. So kind of go into that intake session knowing what you wanna share with them right off the bat. So an example of a presenting problem would be if a client came to me and they were like, hey, I'm starting therapy because I've been noticing that I'm feeling more irritable or angry lately. That would be the presenting problem. The third thing that's going to happen is that your therapist is going to ask a bunch of background questions. So a lot of therapists call this the psychosocial assessment, and that's because it goes through your emotional and mental health, but also just things about your social life, basically every aspect of your life. So family, childhood, whether you've experienced trauma, your medical history. A therapist is going to just ask you a bunch of questions about all of those things. Here's a little secret. During either the time when you share the presenting problem or the background question part, you might cry. Even if you're not much of a crier, you might cry. I know this from personal experience. The first time I saw a therapist was when I was in grad school to be a therapist. So I was obviously really stressed because I was in grad school, and just life things were stressing me out too. And so I was like, well, let me find a therapist. I'm going to be a therapist, so I should see a therapist so I can know what it feels like as well. Every therapist should go to therapy at some point because it's important to know what it feels like on the other end. So anyway, I went to a therapist. Took me forever to call the number for the therapist because I was so anxious about it. And in the first session, I cried so much, which was unexpected because it's not like I was going for like a recent trauma that had happened or a breakup or anything that was like sad. It's just honestly, a lot of times clients cry in that first appointment because you're talking out loud about things that you usually don't talk about with people. You're saying things out loud that maybe you've never said out loud before, or just having the space to like share whatever you're feeling can be overwhelming because we usually don't have the space to do that. We don't want to burden family or friends, or no one's asking us how we're feeling. No one's asking us these type of questions. So it can just be really overwhelming. So if you cry, you're not a freak. It's really common. So the reason the therapist is going to ask you all of these background questions is because first, it's important for them to get to know you. Second, if they're going to have to diagnose, which isn't always necessary, like they don't always have to diagnose, but if they do, it's important for them to have all that background info and also know exactly what symptoms you're experiencing. So if you mention that you're feeling anxious or worried about something more recently, I'm going to go through the symptoms of anxiety and assess whether you have enough to be considered for a diagnosis of anxiety. But if somebody's coming in for relational issues, there's no like depression or anxiety or other things like that happening, then I'm probably not going to diagnose them. But it's still important for me to have background info on past relationships and family relationships and what their childhood was like, because sometimes that information can give us information about root causes for the presenting problem. So the thing that's bringing the client into therapy. So for example, our client that comes in with more anger and irritability, she's noticing that she's snapping more on her partner. And so during this assessment that the therapist does, the therapist finds out that a year ago, almost exactly, the client lost her mom. Her mom passed away. And the client may think like, oh, that doesn't feel significant necessarily because of course I'm still sad about it, but it was a year ago. But as a therapist, I know that anniversaries around significant life events like deaths or traumas can be really important. They can stir up some things either consciously or unconsciously. So I might take note of the fact that, okay, this person is exhibiting anger and irritability, but this could be due to the fact that she hasn't fully processed the loss of her mom, and the anniversary of this death is kind of stirring some of those things up. And so anger is actually the secondary emotion to grief and loss and sadness. The fourth thing that's going to happen is you guys should be discussing goals for treatment. So as a therapist, I tend to be more solution focused. I know that sometimes we're going to have to process and just vent, but also I know that you're paying a lot of money to see me as your therapist. And so you are not just going to want to come in and talk to me like you would talk to a brick wall or like you could talk to a friend. Like you're going to want to get something in exchange. So that means that I'm trying to give you solutions or tools to help you feel better in whatever area it is that your presenting problem is in. So for me, talking about what our goals for treatment are is really important. Some therapists might not do this, especially if they aren't paneled with insurance and they're just kind of doing private pay. They might feel like, oh, well, nobody's kind of like making me show them the goal, so I don't need to do this. But for me, it feels really important because it means that we are staying on track and it helps me just focus in on what tools I want to present to you. So for example, this client with the anger, irritability, some goals that we might talk about for her are obviously reducing the anger and irritability. So maybe finding some coping skills, talking about her triggers for for anger. And then the second one would probably be to process any feelings of grief and loss she has about her mom. Number 5 is that you can and should ask the therapist questions. So usually this is like, how long have you been a therapist? What kind of treatment do you use? So for therapists, we call this our modality. So our modality is like how we go about treating things as a therapist. So there's different ways. Maybe you've heard of CBT, that's one of modalities. So you could ask them about that. Some therapists don't like to answer personal questions. As a therapist myself, I don't mind answering personal questions as long as they're not too invasive, like, oh, do you have kids? What are their ages? Do you live in the area? Things like that. I really don't mind doing that because I think it's important for us to build a connection where like you know a little bit about me. I don't like the idea of like a blank slate therapist where like I know everything about you and you know nothing about me, unless that's what you want. If you don't want to know anything about me, that's totally fine. But I've just found that it helps the clients feel more connected to me when they just know like a few things about my life. So again, some therapists don't like answering personal questions about themselves, but if you ask them about anything having to do with therapy, like how they practice or where they see therapy going with you, or if they have any thoughts about what you've presented them with so far, if they get defensive about any of those things, that's definitely a warning sign. Like they should be telling you what therapy is going to look like with them, where they see it going. So yeah, keep that in mind. Definitely ask your therapist questions, because remember, this is the time for you to decide if they're going to be a good fit for you. You're not trying out for them, they're trying out for you. So they need to kind of sell themselves. That sounds bad. They need okay, they need to convince you that they are the right therapist for you. So they should be answering your questions. And if they don't feel comfortable answering personal questions, again, that's fine, but they should be answering questions about therapy. All right, I think I've said that enough. Number 6 is the therapist should be giving you some initial thoughts. Maybe not should, but definitely I do. So like if a client's bringing stuff in, I'm like, here's my initial thoughts about what's bringing you in. So I might say to this client, like, it kind of seems like your anger or irritability might be a secondary emotion, but the primary emotion is some unresolved grief and loss. And here's where I think we could go with that. And here's what I would want us to work on. So I would provide those initial insights that I'm kind of finding in that first appointment. And for me, assessment goes a few appointments after that. I'm not going to really be presenting you skills until I know you really well and I know what matches to you. Because if I give you skills and I don't know you well, you're going to leave my office and they're not going to fit your personality. They're not going to fit your lifestyle and you're not going to use them. So assessment for me is like 3 to 4 sessions, including the intake, but I will offer initial insights just so the client kind of knows where we're headed. And also I'll make a recommendation on how frequently I think we should meet, but ultimately I do leave that up to the client because again, you're paying out of pocket for sessions with me. So I'm not gonna like break your budget with therapy appointments if you can only make it every other week. You know, I'm not gonna say like you're required to come every week. That would be wrong. And the 7th thing is that you get to decide whether or not you want to schedule another session. So at the end of my sessions with clients, I'm always like, okay, it's up to you. Do you want to look at scheduling another one now? Do you want to think about it and get back to me? Because that takes the pressure off them if they want to think about it. It's totally fine if you want to think about it. You might be like, oh, the cost is kind of high. Let me see if I can work it into my budget. Or I'm not sure our personalities go together. Let me think about it. So it's up to you whether or not you want to schedule again. The therapist will present options and you get the choice to say, let me think about it. And can I email you or call you? All right, so those were 7 things that happen in the initial intake appointment with your therapist. I hope this was helpful for you guys. Again, I'm just somebody who likes to have all the information. I hate going into situations with like the unknown. It just makes me so anxious. So I'm gonna leave a few more videos up here if you're interested in learning more about what happens in therapy. I'm gonna leave these here and feel free to watch more. Like I said, feel free to comment. I would love to hear from you guys and I'll see you on the next one. Bye.